When Bernie Sanders visited Ontario last fall to learn more about our universal healthcare system, we talked about how it is the truest expression of our values of fairness, equality, and compassion. But we don't have all the answers. There's always more that we can do. My vision for healthcare in Ontario is essential to my vision of a province where everyone has the support that they need to care for themselves and to care for their loved ones, and where everyone can find opportunity and get ahead in the changing economy. So we're working to put patients first in Ontario, and I'm grateful nurses are right there with us. We know primary care is best delivered by a team of professionals all working together to keep people healthy at home and in their communities. So we're investing $102 million over 3 years to expand access to team-based care across the province. That means 19 new and expanded teams that will recruit 100 new healthcare providers, including registered practical nurses, registered nurses, and nurse practitioners. And nurses will continue to play a pivotal role as we improve healthcare across our healthcare system, especially as we move forward with the greater investments in long-term care that we've outlined in our budget. In our spring budget, we've promised to hire 1 additional registered nurse for each of the province's 627 long-term care homes. We're adding 30,000 long-term care beds over the next 10 years on top of the 30,000 we're already developing, and we've committed to reaching a provincial average of 4 hours of direct daily care for every resident in long-term care. This is about opening more doors to care when and where people need it, and we can't do any of that without nurses. We're going to continue to rely on your advice and your expertise to get this right. Universal health care means just that. So we're making investments to ensure that people can continue to rely on excellent care no matter who they are or where they live in Ontario. And I want to thank nurses for working in partnership with us, working with us to ensure these investments result in increased access to primary care and care for high-risk populations. We need to support you in this challenging and emotional work, especially in northern and rural communities. Nursing care plays a critical role in the care that people receive in their communities. Your position on the front lines is why we've expanded the scope of practice for controlled drugs and substances, and why we've created 27 new nurse practitioner-led clinics which provide faster access to family health care for more than 60,000 patients in communities across the province. Our government has also made the single largest investment in Indigenous health care in our province's history when we launched the Ontario First Nations Health Action Plan to expand access to community-driven primary care teams. And we made history again with a $2.1 billion investment in mental health care in our spring budget. Nurses will play a critical role as we bolster mental health care and addiction services, and they'll provide expertise in areas like mental health assessments. Nurses are essential to every single aspect of patient care. Last fall, I attended a baby shower at Mount Sinai for a little girl named Aiko. Before she was even born, Aiko was operated on in Canada's first in utero spina bifida surgery. Today, she's thriving, and her parents are so relieved and so grateful. And it's all because of the strong team of healthcare professionals who surrounded them in their time of need. That's why the number of nurses employed in Ontario has increased every year since I became Premier, and will continue to increase as long as I'm serving in this role. My message to nurses during National Nursing Week is thank you. Thank you for the extraordinary care you provide every day, for being excellent patient advocates, and for making our healthcare system a shining example of a society in which people care for each other. What I hear from families across Ontario is that today they need that care more than ever. So we're stepping up with big increases in healthcare spending. And Ontario is playing a leading role by pushing for universal pharmacare. Already this year, we made prescription drugs free for everyone under 25 years of age. Already, more than 3.5 million prescriptions have been filled. We're expanding pharmacare coverage to seniors 65 and over starting next year. And I'm not going to stop until Medicare means pharmacare for everyone in Ontario and across Canada. We can do this. I know that we can. We're also introducing a new program to help families cover the costs of dental care and prescription drugs if they aren't covered by OHIP Plus or a workplace plan. These are the kinds of big ideas that are making a real difference in people's health and well-being. Because it isn't enough just to protect our healthcare system. We need to expand it, we need to grow it to meet people's changing needs and be there for families during this period of rapid change. But as you know, ours is not the only vision for our province. This is a highly political moment in Ontario. We all know that there's an election coming here, and there's an alternative path out there that is informed by a very different worldview. Doug Ford is talking about running government like a business and finding $10 billion worth of efficiencies. And when Doug talks about efficiencies, what he's actually talking about are cuts. There is no way that you can find $10 billion without touching healthcare or education. And when Conservatives choose cuts over care, our whole province suffers. The truth is, a healthier Ontario will be a stronger Ontario. So like you, I will always put care first. I know how hard you work to do that. My youngest daughter, Maggie, graduated from Ryerson's nursing program last spring, and she's now working as an emerge room nurse. Her commitment to her patients is amazing to me. But I know that to nurses, that's just what you do. You care for others, and it's up to all of us to care for you. So again, I want to say thank you. Thank you from the bottom of my heart. When we support each other and work together, we can create real and positive change in the lives of all patients. Thank you, and my very best wishes for a happy National Nursing Week.